One of the most frustrating issues during the coronavirus outbreak is the amount of conflicting available information regarding all aspects of the disease. Scientists seek to look at data objectively and to come to their own conclusions that are evidence-based. This video takes on an objective approach to understanding the coronavirus data. The number of COVID-19 cases and deaths are being reported daily by multiple media sources. But what do these numbers really mean? These numbers are coming from the Center of Disease Control, or the CDC. However, the story told by most media outlets and simple glances of the COVID-19 case numbers and deaths tells a very different story than the one that you can find when you explore the CDC website. To the vast majority of US citizens, the data does not mean what they think it means. CDC case counts and death counts include both confirmed and probable cases and deaths. When you arrive at the CDC website for the novel coronavirus, located here, you see a staggering number of total cases and total deaths claimed by the CDC. However, a deeper dive into the CDC's own website explains how these numbers are not as they seem. When you click on the tiny link that says About the Data, the numbers begin to unravel. On this page, you will find a section titled Accuracy of Data and Confirmed and Probable Counts. According to the CDC website, CDC case counts and death counts include both confirmed and probable cases and deaths. This change was made to reflect an interim COVID-19 position statement issued by the Council for State and Territorial Epidemiologists on April 5, 2020. Let's take a look at the link that provides information on what is being counted currently under COVID-19 cases and COVID-19 deaths on the CDC's website. Here we have the document, the Interim COVID-19 Position Statement. This document outlines the criteria that must be met to report a person's status as having had COVID-19. Criteria 1. A patient must have 2 of the following symptoms. Fever. This may be measured or subjective. Chills, muscle aches, headache, sore throat, or changes in the senses of taste or smell. Or at least one of the following symptoms: cough, shortness of breath, or difficulty breathing. As a scientist, I find it alarming that persons fitting this criteria are being automatically counted as having COVID-19. According to the CDC's webpage found here, the CDC estimates that the flu has resulted between 9.3 million and 49 million illnesses each year in the United States since 2010. If this statement by the CDC is accurate, there is no way of substantiating that patients fitting this criteria alone indeed have COVID-19, as opposed to the tens of millions of people suffering from the flu or similar illnesses each year. On average, more than 200,000 people in the United States are hospitalized each year for illnesses associated with the influenza virus. To make the matter more complex, Wikipedia cites 50 different medical conditions that have flu-like symptoms. Let's look at the CDC's Criteria 2 for counting somebody in the COVID-19 case numbers. Criteria 2. Laboratory evidence using a method approved or authorized by the FDA or designated authority. According to the American Society for Microbiology, at this time there are 2 types of tests that have been FDA approved for the detection of COVID-19. The first is the nucleic acid amplification test. The second is antibody test, also known as serology tests. Only the nucleic acid amplification test shows that a person is actively infected with the coronavirus. Persons testing positive for COVID by the means of the nucleic acid amplification test are considered confirmed cases. Patients testing positive for COVID antibodies via the antibody tests are only considered presumptive cases. The antibody test only shows that a person was exposed to the virus somewhere in the past, whether or not they had experienced any symptoms. The CDC website states clearly that there is currently no criteria to distinguish a new case from an existing case. However, on the front page of the COVID-19 CDC website, there is a report of new cases. So, which is correct? What this really means is new probable and confirmed cases combined. This includes anyone that can be categorized under the very broad criteria of probable cases, as well as anyone who has tested positive for the coronavirus antibodies, meaning that they have been exposed to the virus sometime in the past and are not necessarily active cases. When the media uses these numbers to state that the coronavirus is spreading is simply inaccurate. The only way to confirm a COVID case is by using the nucleic acid amplification test. Drive-through testing uses the antibody test, not the nucleic acid amplification test. For persons in the government and media to interpret this as any indication of new spreading of the virus is simply incorrect. So, how many confirmed positive test results do we currently have in the US? I did several searches looking for confirmed cases and found something very alarming. Several respected news media outlets are reporting the totals from the CDC as confirmed cases, while the CDC themselves profess that these numbers are both confirmed and probable cases. Criteria 3, epidemiological linkage. A person is added to the unconfirmed COVID case numbers if they meet any of the following criteria. If a person has had any symptoms and has been exposed to anyone classified as a confirmed or probable case of COVID-19, or if they have traveled to or reside in an area with sustained ongoing community transmission of the coronavirus. This includes the majority of states and cities across the U.S. The person may be identified as having COVID-19 if they are a member of a risk cohort as defined by the public health authorities during an outbreak. The following are identified as risk cohorts: hospitalized patients, healthcare workers, first responders, including law enforcement, fire services, emergency medical services, and emergency management officials. Also, residents of long-term care facilities, members of other congregational settings, including group homes, schools, colleges or universities, correctional or detention facilities. So a person suffering from headaches and a sore throat that is a firefighter would automatically be included in the unconfirmed COVID case numbers. Keep in mind, the CDC states between 9.3 and 49 million influenza illnesses each year in the United States. Criteria 4. A death certificate that lists COVID-19 disease or the coronavirus as a cause of death or a significant condition contributing to death. In April 2020, a memo was distributed by the CDC called Vital Statistics Reporting Guide, Guidance for Certifying Deaths Due to Coronavirus Disease 2019. This document states that it is acceptable to report COVID-19 on a death certificate without testing confirmation in cases where a definite diagnosis of COVID-19 cannot be made, but it is suspected or likely. It is acceptable to report COVID-19 on a death certificate. A death due to COVID-19 is defined as a death resulting from a clinically compatible illness in a probable or confirmed COVID-19 case. Any patient dying from pneumonia or COPD, coronary artery disease, existing chronic conditions, or compromised immune system is automatically presumed to have died from complications of COVID-19 and is reported as a COVID-related death without laboratory testing. Why is this a problem? The CDC states that 50,000 people die from pneumonia each year in the United States. The World Health Organization states that 3.17 million deaths were caused by COPD in 2015 worldwide. According to the United Census Bureau, as of today, the U.S. population is nearly 330 million. If we assume that every single presumed case is indeed a true COVID-19 case, even then, we find that as of today, only 1.08% of the U.S. population is or has been infected by the novel coronavirus. Close to 50% of these people will experience no symptoms whatsoever. The CDC reports that the number of cases being confirmed by laboratory testing by both methods is 2,461,000, which brings us to only 0.745% of the U.S. population. According to the CDC today, there have been 137,000 deaths attributed at least in part to COVID-19, both confirmed and presumed. If we assume that this is correct, even then we find that as of today, only 0.04% of the U.S. population has died from complications surrounding the coronavirus. Of these 137,000 deaths, only 6%, or 8,271 deaths, were reportedly caused by the coronavirus alone. So why is the media not distinguishing between confirmed cases and deaths versus non-confirmed cases and deaths? And why are the numbers not being presented as a percentage of the population? I suspect that ratings may play a role here. Also, misleading the public, whether purposeful or not, has allowed the government to take away civil liberties, cripple the economy, and decimate entire industries that were deemed non-essential.